Good afternoon, everyone. I'm Shayne.
I'm Anushka.
And I'm Jensyn.
And today, we want to start off by asking you this. Imagine yourself standing at the top of a tall bridge that's crossing over the ocean with the sun setting on the horizon. Would you either A, just keep walking and enjoy your view, B, walk towards the edge and slightly lean over for a small rush, C, completely run and jump off the bridge into the water, or D, none of the above?
Please answer on your screen now.
Thank you for answering. Now Shayne will continue to explain what these answers mean.
For those of you that chose answers A, B, or D, these would all be considered more normal, calm thoughts. However, if you went the more exciting and thrilling route and chose answer C, in the moment you would be having an intrusive thought. There's a wide range when it comes to intrusive thoughts with both a positive and negative side, and both happen to the general population. However, negative intrusive thoughts are more easily identified. Oftentimes, negative intrusive thoughts can lead to underlying medical conditions such as OCD and eating disorders. Today, we will be focusing on what intrusive thoughts are, what happens in the brain with intrusive thoughts, if they're harmful or concerning, impulsive versus intrusive thoughts, and ways to control these intrusive thoughts.
Everyone gets these intrusive thoughts. These thoughts are disturbing or uncalled for thoughts that come through your brain. According to WebMD, 93% of people get an intrusive thought every 3 months. Intrusive thoughts have many causes that can lead to these thoughts that one are having. The most common cause that one has leading to these intrusive thoughts is the fear of forgetting. This can lead to many intrusive thoughts like the fear of a sickness coming, fear of violence, or anything like that.
So now I have a demo for you guys showing a visual of what intrusive thoughts could look like. So inside here I have a bag, and Jensyn will pour water into the bag. And I also have a pencil. And what we're going to do is we're going to penetrate the bag with this pencil. But before we do that, I want you guys to guess what this demonstration is supposed to show and what the objects are supposed to represent. So hopefully you answered that question, and now Shayne will actually penetrate the bag with the pencil. As you can see, no water leaked out whatsoever, and if you guess correctly, the pencil is supposed to show an intrusive thought while the water is the mind. The pencil penetrates through the mind, but it doesn't leak out, and just as a thought does in the mind. And so hopefully that helped you understand more about what intrusive thoughts are and how they work.
As shown in this demonstration, you can see that the water is not leaking out. Just like Anushka explained, this is like the thought is not leaking out. Intrusive thoughts are not harmful at all. One may think that they are harmful since they are very sudden. They come out of nowhere without any warning before that you get these thoughts. These thoughts if you don't react on these thoughts, one will be totally fine with them. Any thought can come from a root cause of anxiety, high levels of stress, or even mental disorders like OCD. All of these are root causes of why intrusive thoughts are not harmful and why one is totally fine if they have an intrusive thought and they don't react on one. Throughout this speech so far, most of you guys have probably had impulsive thoughts in the back of your mind and been thinking that, aren't these the exact same thing? Most people think that intrusive and impulsive thoughts are the exact same thing, and they are very commonly misinterpreted. Intrusive thoughts are completely different from impulsive thoughts. Intrusive thoughts can be thoughts that are unwanted, very sudden, and without warning. Where on the other hand, impulsive thoughts, you have a warning from like an event that might have happened or anything previous to these thoughts coming, and they're not very alarming or sudden. For example, say you watch a scary movie and you're starting to have thoughts about these scary movies after. This would be an example of an impulsive thought, as one has an event that occurred before they're having these thoughts and aren't very concerned about the thoughts they're having. Say you don't watch a scary movie, nothing happens before you start having thoughts. You start having thoughts about scary things, and you have no clue why you're having these thoughts. These thoughts are alarming, and you may be worried why you're having them. This would be more of as an intrusive thought that one may be having.
Some more examples of impulsive thoughts, according to Compass Health Center, could be just overbuying when you know you don't have enough money, or in the middle of a conversation, thinking about blurting out something that might not be appropriate, or even when you're singing happy birthday, thinking about smashing into the birthday cake. And all of these are not extremely harmful, but they don't cause any discomfort. And also, we have a question for you now that you've learned more about impulsive and intrusive thoughts, so you can go ahead and answer that question now. So now we're going to tell what happens in the brain when an intrusive thought occurs. The brain has intrusive thoughts due to its wiring being towards negative thoughts, and this comes from the fight or flight response. According to what is flight or flight response, what it is and how does it work, it states that the fight or flight response tells the body to either stay and fight a perceived harm or run away from it. And there are three major parts in the brain that have to do with this. The prefrontal cortex being what controls actions, the amygdala being what controls fear, and lastly the hippocampus, which controls memories. In addition to these three brain parts, there's also a neurotransmitter called GABA. This neurotransmitter transmits memories throughout the brain, and according to a study done by the University of Cambridge, when there was less GABA in the brain, there was more intrusive thoughts and it was much harder to control, while when there was more GABA in the brain, it was a lot easier to control these intrusive thoughts. And as you can see here, these pink dots are the GABA in between the neurons, which are these big purple bumps.
Now that we know what intrusive thoughts are, you may be thinking about past intrusive thoughts you may have had, while others may be thinking, what are they even talking about? And that's okay. Whether we know it or not, everyone has intrusive thoughts. Oftentimes, negative intrusive thoughts can be amplified by mental conditions such as OCD, anxiety, or PTSD. However, they're amplified the most through OCD, as intrusive thoughts are the base of the condition. According to NOCD, 1 in 40 US Americans have OCD, while about 3% of the global population suffers from OCD. According to the Mayo Clinic, OCD, or obsessive compulsive disorder, is a mental condition that stems from intrusive thoughts. A person will have this intrusive thought over and over again until it becomes a daily pattern and obsession. OCD works in a cycle, starting with the intrusive thought. Originally, this intrusive thought will cause whoever is having it some form of anxiety and distress, as they can't immediately act upon it. Once they are able to act upon it, they'll feel some form of temporary relief before another intrusive thought enters their brain and the cycle repeats itself. Now, the original intrusive thought can be as random as wanting to check to see that there are a full 52 cards in a deck. For example, if I were to be having this intrusive thought, I would want to go and count them and make sure that they're all there. Once I went through and counted them and knew that they were all there, I would then feel some form of temporary relief. However, if I had OCD, I would continue to count this amount in order to feel the same relief I once experienced. So here we just have a quick little video for you guys that could be a possible trigger for someone with OCD. So just go ahead and click on that link now. Now, if this video caused you any uneasy feeling or form of distress, imagine having that feeling countless times a day as someone with OCD would. Now, intrusive thoughts can be the cause of OCD and some eating disorders. According to the International OCD Foundation, 41% of people who have an eating disorder also suffer from OCD, and this number can be represented by this teal color here. The two most common types of eating disorders are anorexia and bulimia. Anorexia is the fear of an uncontrollable fear of gaining weight. When a person experiences this, they will have an extreme lack of appetite and will be very malnourished, causing them to be very underweight. On average, a person with anorexia will be 15% below their average weight count. With someone who has bulimia, it'll happen in a cycle of both binging and purging. This cycle starts with a food binge, meaning that they will uncontrollably eat whether they're still hungry or not, or even if they want to eat or not. After they consume all of this food, they'll have a big feeling of guilt and a low body image. And because of these factors, they'll begin to want to lose this weight as fast as possible by either extreme fasting or excessive exercising. As people with bulimia's weight fluctuates up and down, they're still usually within the normal range. People with anorexia say that their intrusive thoughts are almost like a continuous voice in their head. And they say that this voice tells them that they shouldn't be eating and that they should restrict what they're eating because they are not good enough.
Since one may get intrusive thoughts not very often, and they occur very suddenly, controlling them can be very hard. It's almost near impossible to control intrusive thoughts, but you are able to control the effects intrusive thoughts have on you. I was able to talk to someone that has intrusive thoughts very oftenly and has to find ways to control the effects of these intrusive thoughts. She was able to tell me about how she has to talk about the causes of these thoughts and has to find the root causes of these. This allows her to be able to have less effects after having these intrusive thoughts. I was able to dive a bit deeper into this and find that these affect how once you find the root cause of an intrusive thought, it allows you to then know your brain to then release a neurological feeling that prevents you from acting on these thoughts one may be having. So even though you cannot prevent these thoughts from coming into your brain, one is able to reduce the effects that you may have that comes after these thoughts.
Now, another way to control both intrusive thoughts and OCD is by what's called cognitive behavioral therapy, or CBT. CBT is a form of psychotherapy, meaning that it works by having the patient talk about what's happening within them in their mind and body. CBT will focus on the intrusive thoughts that the person is having and convinces them that they're just regular, normal thoughts and don't have anything to do with the external happenings around them, as people with OCD believe that if they don't act upon their intrusive thoughts, bad things will happen.
Intrusive thoughts are extremely complex, and it could possibly lead to many underlying disorders such as OCD and eating disorders. And while researching, we had multiple questions come up that answering could be very helpful. The first one being, is there a way to permanently control intrusive thoughts? And if so, could this help with disorders such as OCD and eating disorders? We think answering these questions would be extremely helpful for scientists to figure out more about what happens in the brain during intrusive thoughts and just the overall idea of them. Now I want you to think back on the previous scenario that Shayne gave in the beginning of the presentation. And if you had an intrusive thought on the time, hopefully you could trace back why you had this intrusive thought and how to reduce the effects of it. Thank you, and here are our references.